So, welcome everybody for this session on liver. Liver is the largest gland and the second largest organ. Largest gland in the body and second largest organ, the first largest organ being the skin. Now this liver weighs 1600 grams in males and 1300 grams in females. Okay. It is reddish brown in color. Now let us talk about the location of the liver. These are the 9 quadrants of the abdomen, and the location of the liver is like this. So it occupies the right hypochondriac, the epigastrium, the left hypochondriac, and the right lumbar region. It occupies 5 regions, so we understand that how large it is. The liver is divided into right and left lobes. Suppose this is the liver. It is divided into right and left lobes by falciform ligament anteriorly, ligamentum teres, which is the left umbilical vein actually. So ligamentum teres inferiorly, falciform ligament anteriorly. And if we look at the liver from the posterior aspect, on the posterior aspect, there is this fissure for ligamentum venosum. Fissure for ligamentum venosum. So ligamentum teres, this is ligamentum teres. So fissure for ligamentum venosum posteriorly. So liver is divided into right and left lobe by falciform ligament anteriorly, ligamentum teres inferiorly, and fissure for ligamentum venosum posterior. Now the surfaces of the liver, we can see here, this is the anterior surface, this is the superior surface, this is the right surface. On the posterior aspect, there are 2 surfaces. This surface is the posterior surface. And this surface goes slightly like this below this, and this surface is the inferior surface. So liver total has 5 surfaces: the superior surface, anterior surface, right surface, posterior surface, and inferior surface. All the borders of the liver are rounded except for this one border, which is called as inferior border. Inferior border. Now let us study the relations of the liver and the external features. The liver, when we look from the anterior aspect, is like this. This is falciform ligament, and this here is ligamentum teres. So, of course, this goes like this. On the anterior aspect, the liver is related to 3 structures. Rather, I'm going to divide this entire all the relations of all the surfaces into group of 3. Okay. The anterior surface of the liver is related. Now we are talking about the visceral relations. I will talk about the peritoneal relations also. Right now I'm talking about the visceral relation. So the anterior surface of the liver is related to, so this part is related to the anterior abdominal wall. Okay, abdominal wall. And so there are 3 relations as regards the anterior surface of the liver is concerned. One, anterior abdominal wall. 2, rib cage. And 3 is diaphragm. So relations, we are talking about the visceral relations, anterior surface relations I have spoken with you. Now let us talk about the relations of the superior surface. The superior surface goes slightly like this, and so here is pericardium. And here is the right lung, here is the left lung, and of course in between is the diaphragm. So superior surface of the liver is also related to 1, 2, and 3. So 1 is diaphragm, 2 is pericardium, and heart, of course, pericardium and heart, and 3 is pleura and the lungs. Now we talk about relations of the right surface. Right surface. Now the right surface is divided into 1/3, 1/3, 1/3, upper 1/3, middle 1/3, lower 1/3. Covering throughout is the diaphragm. Now with this green color thing, I'm drawing the pleura, which goes up to only 2/3. And with red color, what I'm drawing is the lung, which only goes in the upper 1/3. So yes, again the right surface is related to 3 things: diaphragm, pleura, and lungs. But in upper 1/3, there is diaphragm, pleura, lung. In middle 1/3, there is diaphragm and pleura, and in lower 1/3, there is only diaphragm. So this part where there is no lung but only diaphragm, this is the extra space provided to the lung for expansion, and this is called as the uh, postodiaphragmatic recess. Postodiaphragmatic recess. Now let us talk about the posterior surface and inferior surface, which we can see in one go. Rather, instead of giving you this view, I would like to draw it in the opposite way. 1 second. So and inferior surface of the liver. So the peritoneum comes here like this. And these are lines of peritoneal reflection. That means the peritoneum will come from the anterior surface to the posterior surface and gets reflected like this. The peritoneum comes here and gets reflected over the kidney. And this peritoneum comes here, 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 here. And this is the L shape. From this L, it goes to the lesser curvature. This is the bare area. Rather, this whole area is bare. There is no peritoneum here because peritoneum is reflected from here. Peritoneum is reflected from here. So from here, it goes below the diaphragm. From here, it goes like this on the posterior abdominal wall. So therefore, these are all bare areas of the liver. Okay, this is called as the left triangular ligament. This is called as the right triangular ligament. Hmm. This is fissure for ligamentum venosum. Fissure for ligamentum venosum. This is ligamentum teres. Here is the gallbladder. This lobe is called as quadrate lobe. This is fissure for ligamentum venosum. This PH is porta hepatis. Porta hepatis. From here, so this is a port. From here, the portal vein will go inside. From here, the hepatic artery will go inside, and from here, the bile duct will come outside. Porta hepatis. So quadrate lobe is bounded on the left side by ligamentum teres, inferiorly by the inferior border of liver, superiorly by porta hepatis, and on the right side by gallbladder. This is the quadrate lobe. While this lobe over here is the caudate lobe. This lobe here is the caudate lobe. CAU, caudate lobe. Now here in this bare area, here is the IVC. IVC, inferior vena cava. So caudate lens boundaries are to the right side is fissure for ligamentum venosum. Inferiorly is porta hepatis. On the right side is the inferior vena cava. Superiorly it is continuous with the superior surface. So these are the boundaries of the caudate. Now grossly, when we look at the various relations, here is the area where esophagus is related, and then there will be stomach. Okay, here will be the first part of duodenum in the quadrate lobe. The pylorus will stop here, and the second part of duodenum goes like this. Okay, the kidney is related here, kidney posteriorly, and above the kidney is adrenal gland. So the suprarenal gland is related here in this bare area. Okay. In this caudate lobe is related the right crus of diaphragm. Okay. So now let's, with the help of this diagram, let's start enlisting the structures related to the posterior surface. So grossly, what is above this line will be the posterior surface. What is below here is inferior surface. So actually, the kidneys will be like this over here, and the suprarenal will be somewhere here, related posterior. Hmm? So the posterior surface, so suprarenal is here. Posterior surface is firstly having one bare area. This bare area is related to the suprarenal. Okay. Suprarenal. 2. Fissure for ligamentum venous. 3. IVC. 4. Caudate lobe and right crus of diaphragm. 5. Esophagus. Hmm? While the inferior surface, esophagus is here, inferior surface will be related to one stomach, left side. So stomach will be here, stomach. To first part of esophagus. Where is first part of esophagus related to? In the quadrate lobe. In the quadrate lobe. 3. Gallbladder. 4. Kidney. Okay. So these are the relations of the inferior surface. Now, actually, we are supposed to discuss the peritoneal relations first, but I talked about the visceral relations first. Now we'll talk about the peritoneal relations. The liver is covered by peritoneum, except for few bare areas. So what are those bare areas on the liver? One is the bare area on the posterior surface, right, where the suprarenal is related. This bare area, this is a large bare area. 2, the groove for IVC. Then fossa for gallbladder. Fossa for the gallbladder. Then porta hepatis. Porta hepatis. Fissure for ligamentum venosum. So these all areas will not be covered by peritoneum. You can see here, there are 2 layers of peritoneum. Fissure for ligamentum venosum, porta hepatis. This is the bare area. So in this area is not covered with peritoneum because the peritoneum gets reflected from here. Okay. So liver is covered by peritoneum except for this bare area. The large bare area on the posterior aspect, groove for IVC, fossa for gallbladder, porta hepatis, and fissure for ligamentum venosum. Now let us talk about the blood supply of the liver. 80% of the blood supply comes from the portal vein. 20% comes from hepatic artery. Okay. So both hepatic artery will divide into right and left branches and then redivide. Venous drainage. There are 3 hepatic veins. These 3 hepatic veins, they, suppose this is the IVC, they open like this. Rather, these 3 hepatic veins are the ones which actually hang. They are not only the venous drainage, but they are the main supports of the liver. all this falciform ligament, ligamentum teres. So when we talk about the supports of the liver, okay, when we talk about the supports of the liver, the supports of the liver are the hepatic veins. In the exam, don't talk about falciform ligament and don't talk about ligamentum teres. It's the hepatic veins surrounding viscera and the intra-abdominal pressure. These are the three supports of the liver, intra-abdominal pressure. Okay. Then talking about the lymphatic drainage, it mainly drains into hepatic, paracardial, okay, and celiac lymph nodes. The nerve supply comes from the hepatic plexus, okay, which contains both sympathetic and parasympathetic fibers. Some textbooks they talk about the hepatic segments also. These hepatic segments, there are multiple ways of dividing the liver into the hepatic segments. You know, there are segments like this: the right anterior, right posterior, left anterior, left posterior, left anterior. Okay. Now, in the exam, when the question is asked, they also ask about development of liver. Development of the liver is from the hepatic bud, which arises from the foregut, near the junction with the midgut, but from the foregut. And this hepatic bud goes into the septum transversum and divides. So in short, the hepatocytes, they develop from hepatic bud, from foregut. The Gleason's capsule develops from it develops from septum transversum. So Gleason's capsule and the fibrous network, septum transversum, and the broken umbilical and vitelline veins. Broken umbilical and vitelline veins, they contribute to the formation of sinusoids of the liver. So that's the development of the liver from the hepatic bud. This hepatic bud further divides into hepatic bud and cystic bud. From the cystic bud develops the gallbladder. Okay. In the exam, they ask development for 2 marks and they also ask for histology. So in the histology of the liver, we talk about there are the this is the central vein. This is a typical for a hepatic lobule. This is the central vein, part of the central vein. This is how a typical hexagonal, and then there are cells arranged like this. In between are sinusoids. There are cells arranged like this. Okay. So at these corners is portal triad. Is the portal triad, which contains a branch of hepatic artery, a portal venule, and a part and bile ductule. Portal venule, hepatic arteriole. So they send the blood which goes into central vein, and in between there are cells, hepatic cells, which process it. Okay. So this is what is called as a hepatic lobule, which is drained by one central vein. Then if you see this area, this triangular area. So here will be one portal vein. This portal vein will be sending blood to this central vein, to this central vein, to this central vein. So this is called as a portal lobule. So portal lobule is area supplied by one portal venule. This is one area drained by central vein is called as hepatic lobule. Okay, and I'm going down further. Now consider this area. Now here one hepatic arteriole is running and it is sending blood like this. So this area is called as the hepatic acinus. Hepatic acinus is the area supplied by one hepatic arteriole. Okay, so you have to write about hepatic lobule, area drained by one central vein, then portal lobule, area supplied by one portal venule, and hepatic acinus. You may be thinking why these details, but when you go into second year, you will understand there is zone 1, there is zone 2, zone 3, even in this hepatic acinus. If there is a poison, poison has reached zone 1, it is minor poisoning, it has reached 2 and 3, 3 if it reaches in the forensic autopsy, that means it is severe poisoning. Now coming to the last part of the liver, and that is the applied anatomy. So starting with congenital anomalies, not so much, except for some accessory lobes will be seen. Then investigations of the liver, we know is done by doing SGOT, SGPT, by physical examination, palpation, and USG. Then medically, there is hepatitis, inflammation of the liver is called as hepatitis. There is hepatitis A, B, C, D, E. A, C, D, they're bad. B and E are not so much harmful. A is the common hepatitis which happens. It is foodborne. B, uh, hepatitis B and C, they are transmitted via blood, not good prognosis. So hepatitis B, which is so patient is said to be Australia on antigen positive if is infected with hepatitis B. So B and C are the bad versions. A is the milder version. Surgical amoebic liver abscess. Okay, very common. People who are suffering from amoebiasis, and liver cancer. Liver cancer. Um, the all of us know that this is the liver. The portal vein goes to the liver, divides like this, and then hepatic veins drain it. So in alcoholics, there is what is called as cirrhosis of liver. And because of this cirrhosis, there is portal hypertension, and then the liver is damaged. So alcohol, drug abuse, all these things, they damage the liver, and chronically the liver can become malignant. Okay, that is the liver cancer. So you have to also talk about the cirrhosis of liver. Thank you so much. That's all about the liver.